Glossopharyngeal nerve. It's a mixed nerve. Motor fibers of glossopharyngeal nerve supply stylopharyngeus muscle. Stylopharyngeus muscle. It develops in third pharyngeal arch. Sensory fibers of glossopharyngeal nerve carry sensations from carotid sinus and carotid body to lower part of nucleus tractus solitarius in medulla oblongata. Carry taste sensation and general sensations from posterior one third of tongue. Carry general sensations from tonsils and soft palate. Tympanic branch of glossopharyngeal nerve forms a tympanic plexus and supply middle ear cavity. In case of lesion of soft palate or tumor in posterior one third of tongue or in tonsillectomy, there is referred otalgia, pain in the ear, due to tympanic branch of glossopharyngeal nerve. In case of chronic suppurative otitis media, pain can be felt in posterior tongue, tonsil and palate. Tympanic branch of glossopharyngeal nerve, also known as Jacobson's nerve. It carries secretomotor fibers from parotid gland. Control of inferior salivatory nucleus. Secretomotor fibers from inferior salivatory nucleus, then to glossopharyngeal nerve, then to Jacobson's nerve, then to tympanic plexus, then to lesser petrosal nerve. Passes through foramen ovale, passes through otic ganglion, then to auriculotemporal nerve, then to parotid gland. Secretomotor fibers from inferior salivatory nucleus, glossopharyngeal nerve, Jacobson's nerve, tympanic plexus, lesser petrosal nerve, passes through foramen ovale, then to otic ganglion, auriculotemporal nerve, then to parotid gland. Frey syndrome, also known as auriculotemporal nerve syndrome, also known as gustatory sweating. In case of removed parotid gland, when auriculotemporal nerve regenerates, it may innervate some sweat glands. Cutaneous innervation of face. This causes patient to sweat while food intake. The area may be in front or behind the ear. Treatment. Mark the area of sweat, then inject botulinum toxin to kill the aberrant innervation of auriculotemporal nerve. Vagus accessory complex. Nucleus ambiguous. Motor nucleus of cranial nerve 9, 10, 11 forms nuclear ambiguous. Accessory nucleus in spinal cord C1 to C5. Spinal accessory nerve. It enters the cranial cavity through foramen magnum. It exits the cranial cavity through jugular foramen. It supplies sternocleidomastoid and trapezius muscle. Cranial accessory nerve. It is joined by spinal accessory nerve in cranial cavity. It exits the cranial cavity through jugular foramen. It supplies the muscles of palate, pharynx and larynx. Vagal accessory complex. Muscles of palate, pharynx and larynx are chiefly controlled by cranial part of accessory nerve. Vagal nerve itself supplies the cardiac muscle and smooth muscle in the body. Vagus nerve carries axons of cranial accessory nerve to muscles of palate, pharynx and larynx. It is called hitchhiking. Spinal accessory nerve, cranial accessory nerve, vagus accessory complex. Some important information. Now supplying palate, pharynx and larynx. Cranial accessory nerve greater than branch of vagal nerve. Cranial accessory nerve supplies muscles of palate, pharynx and larynx, except stylopharyngeus, which is supplied by cranial nerve 9. Nucleus ambiguous. It is present in medulla oblongata. It is controlled by cranial nerve 9, 10, 11. Muscles of palate, pharynx and larynx are supplied chiefly by cranial part of cranial nerve 11. In case of damage to nucleus ambiguous, like in lateral medullary syndrome or Wallenberg syndrome, difficulty in speech, swallowing and breathing because of same side palatal, pharyngeal, laryngeal muscles are paralyzed. Ula cannot be elevated on affected side. Vocal cord comes on the cadaveric position on affected side. Branches of vagus nerve. Superior laryngeal nerve. Nerve of fourth pharyngeal arch. It divides into two branches. Internal laryngeal nerve supplies laryngeal mucosa till vocal cords. External